Malaysia has a high prevalence of breast cancer cases. 1 in 19 women is at risk with breast cancer, and it is the most commonly diagnosed cancer among women of all ethnic groups. Thanks to the many new treatment options that are available for breast cancer patients, the chances of surviving this cancer has significantly improved over the last decade. Global statistics have shown that 90 out of 100 women remained alive after 5 years of being diagnosed with breast cancer. Whereas in Malaysia, as of 2018, the overall 5-year relative survival rate is 66.8%. Have you heard of the Angelina effect? Back in 2014, the famous actress Angelina Jolie made headlines for having bilateral mastectomy after she was detected to have the BRCA1 gene mutation. So what is a BRCA gene? BRCA gene, also known as breast cancer gene, have 2 types, BRCA1 and BRCA2. If you have BRCA mutation, what are the chances of you getting breast cancer than those without the BRCA mutation? Through studies, it was found that patients with BRCA gene mutations would have a higher chance to develop cancer by the age of 70. Interestingly, those with these mutations only accounts for less than 6% of the total breast cancer cases and would mostly be sequestered into the triple-negative breast cancer group, particularly those with BRCA1 mutation. However, the good news is that PARP inhibitors have been developed to target these BRCA mutations and kill cancer cells that harbors these specific mutations. To decide on which treatment approach would be the best for the patient, it is important to classify the patients according to their specific breast cancer subtypes. Generally, there are 3 different subtypes: hormonal positive, HER2 positive, and triple-negative breast cancer. The classification depends on the type of proteins called receptors that are found on the surface of breast cancer cells. Hormonal positive breast cancer refers to patients with estrogen and progesterone receptors on their breast cancer cells and accounts for the majority of the total breast cancer cases. Not only that, it also has the best prognosis out of the 3 subtypes. HER2 positive breast cancer, also known as the human epidermal growth factor receptor, are those with amplified numbers of HER receptors on the breast cancer cells and takes up to 15 to 20% of the total breast cancer cases. Previously, this subtype had poor prognosis, but has significantly improved due to the new anti-HER2 treatment developments. Lastly, the triple-negative breast cancer, also known as TNBC group, are patients that have neither the estrogen, progesterone, or HER2 receptor present on the surface of their breast cancer cells and accounts for 10 to 15% of the total breast cancer cases. This subtype is known to be the more aggressive subtype and targets those of the younger age group. In general, there are 5 treatment approaches. Firstly, surgery, where the doctor removes the cancer cell together with the tumors in the lymphatic drainage. Radiotherapy uses beams of intense energy to kill cancer cells, whereas hormonal therapy prevents cancer cells from receiving the hormones they need to grow. Next, chemotherapy uses drugs that shrink or kill cancer cells, either through infusions or pills. Lastly is targeted therapy, where drugs are given as pills or injections to target specific proteins on the cancer cells to prevent them from growing or spreading. Previously, surgery was recommended as the first choice of treatment. However, nowadays, chemotherapy and targeted therapy are the preferred treatment of choice advised by doctors to their cancer patients. For hormonal positive breast cancer patients, the treatment of choice will mainly be hormonal manipulation. Hormonal manipulation medicines are mostly in oral form, and some are in subcutaneous injection, making it more convenient for patients. Alternatively, it can also be achieved through either with surgery or radiotherapy. For certain patients, chemotherapy may still be needed to improve outcome and prolong survival. In the past decade, advancements in treatments have greatly improved the survival rates and the quality of life in people with breast cancer. For HER2 patients, targeted agents such as trastuzumab, pertuzumab, TDM1, lapatinib, neratinib, tucatinib, trastuzumab deruxtecan, and margetuximab have been developed to specifically target HER2 receptors in either early or late stage of breast cancer. The use of these agents have significantly improved the prognosis of HER2 breast cancer. Not only does it reduce the rate of cancer recurrence up to 50% for early breast cancer, but it also delays the cancer progression and significantly improves the survival rate for metastatic breast cancer patients. For triple-negative breast cancer, chemotherapy is still the main treatment of choice. However, now there are options to manipulate the immune system to fight the cancer cells through immunotherapy for selected patients. For patients who harbors the BRCA mutation, PARP inhibitors can be considered both in early and late stage. In summary, breast cancer can be classified into 3 subtypes, and the diagnosis will influence the treatment of choice. Treatment for breast cancer has continuously evolved, and over the past decade, it became clear that no 2 patients' cancers are exactly the same. Lastly, the recent advancements in breast cancer treatments have greatly improved survival rates and the quality of life for people living with breast cancer. For more educational videos and information, please visit the Malaysian Oncological Society website or social media.